Hi, I'm Jeff Hoyt, editor-in-chief of SeniorLiving.Org. We all feel the blues from time to time, but how can a senior distinguish between feeling depressed and suffering from clinical depression? Well, psychologist Dr. Abby Altman, who works a lot with seniors, recently wrote an article on depression in seniors for SeniorLiving.Org. You can find a link to that helpful piece in the description below. I had the pleasure of speaking with a geropsychologist on the symptoms of depression, the unique ways depression affects seniors, and current treatments. Because of social distancing, I'll be interviewing Dr. Altman via Zoom. Hi, it's Jeff Hoyt, editor-in-chief of SeniorLiving.Org, and today I'm talking with Dr. Abby Altman. Dr. Altman's a licensed psychologist and geropsychologist, and she's working as a psychologist at Brigham and Women's Hospital in Boston. Hi, Dr. Altman. How are you?
I'm doing all right. Thank you.
Good. Well, we're going to be talking about people who aren't doing all right. I want to ask you about depression, particularly depression in seniors. Now, some people are sad. There's a pandemic going on. People may have something happen in their lives that knocks them for a loop, and people say they're depressed. But when lay people like me say depression, that means something different than being clinically depressed, correct?
Very, very true. I mean, it is kind of part of our day-to-day speak to throw the concept, I feel so depressed today, so depressed to hear that bad news. So we use it. It's a common term to describe an emotional state. But yes, clinical depression, if we're diagnosing clinical depression, it is an actual change in functioning that has to last for at least 2 weeks, where there's a change in somebody's energy levels, concentration, sleeping more, sleeping less, eating more, eating less, general sense of hopelessness. I mean, they might not experience all of that, but there is a change in functioning affecting our engagement with the world, social engagement, impacting just sort of the day-to-day in a large way. So when we're talking about clinical depression, we would want to make sure that folks are, in a sense, being impacted in these major life ways.
So if someone were to lose a spouse, for example, that's a hard hit. Like they may not want to get out of bed for a week. Could that be diagnosed as clinical depression?
So grief is kind of one of those tricky things where grief, like you said, it impacts so much of our day-to-day, how we think, how we act. So it sometimes looks like depression, and sure, it can have those symptoms of depression that we might typically diagnose as clinical depression. However, when somebody is actually going through grief and it's recent, within 6 months, technically, per the psychiatric manuals, the things we follow as medical providers, clinicians, we cannot actually diagnose clinical depression if somebody is in a grief, it has experienced recent grief. So we're usually talking about 2 to 6 months. Past 6 months, after a grief experience, a loss, then we could start considering depression and clinical depression. But per the manual and the guidelines we follow, grief is that understandable reaction. It does happen more in older adults in the sense that grief and loss due to age and health factors can happen more often than in other age groups, but we still wouldn't actually be classifying it or calling it clinical depression if grief was on the table.
And besides grief, what other special situations are there for older people that can cause clinical depression or symptoms of clinical depression?
Generally, when I think of that question, the biggest one that stands out, I'd say, are medical conditions, chronic medical conditions. So there are a good amount of chronic medical conditions that if it's something you're dealing with, no matter sort of the age group you're in, you would have an increased possibility of depression, especially conditions that affect the cardiovascular system. So anything related to the heart, high blood pressure, diabetes, things related to the brain. So if somebody has had a stroke or has possible dementia or mild cognitive impairment, or Parkinson's disease, multiple sclerosis. A lot of those do have a higher incidence or like a significance towards a depression diagnosis. Not to say that that means you will will face clinical depression, but we do see increased numbers in individuals managing chronic health conditions, especially ones affecting the cardiovascular system or our neurocognitive systems.
And so I mentioned, staying in bed for a week, whatnot, as a layperson, but what are some of the major clinical symptoms of depression?
Yes. So staying in bed longer than sort of its benefit is definitely a sign of depression. Lower energy, so less energy, a sense of low motivation, those would be signs of depression. A sense of hopelessness, thoughts of hopelessness, changes in appetites, eating more, eating less, general sense of being slowed down, which is described and observed. Also, sometimes people experience negative thoughts about sort of living. So there might be actually articulation that they would rather have their life be over, or thoughts that they might not want to wake up the next day. Those are all symptoms of depression.
And how bad are the suicide statistics among older people?
With suicide rates, yes, there are increased rates of suicide, plans to take your life, as well as actual completed suicides in older adults. And sometimes the folks who do survive a suicide attempt, the impact on health and wellness can be worse compared to other age groups. So knowing that statistic, it is important to be thinking about depression in older adults and how we could recognize it and diagnose it.
So let's say clinical depression is diagnosed. What are the usual courses of treatment?
So it's generally, folks would, if it's being diagnosed in a sense in a primary care office, you might answer a couple of questions in your primary care office, which might have your primary care doctor wonder if depression is happening. It might be just something in general you're talking about with family and friends. But if it was in, let's say, a primary care office, I imagine at that time you would hopefully talk to your physician about what could be possible. And some individuals start a medication, an antidepressant medication, or something you and your primary care physician might determine would be useful for you after discussing your current symptoms as well as possible side effects. Or they might refer you to a psychiatric prescriber in the community. The other very useful option, which could happen with medication or without, is seeing a therapist, seeing somebody with a Ph.D. or Ph.D., a doctoral degree, more specifically, a licensed social worker, a counselor, and to engage somebody in hopefully evidence-based psychotherapy around depression to help shift the way we think and act in depressive episodes.
And prognosis pretty good in this regard? Are people turned around?
Yeah, I'd say with treatment, prognosis is good. I mean, their depression sometimes does come back. It's one of those things that some people might just have one depressive episode in their life. Some people have recurrent episodes, and your diagnosis is sort of the outlook regarding what to look for and what relapse prevention signs and how to stay on top of that and what help you might need would be important conversations to have with your practitioners. But generally, with treatment, outcomes can be very positive. Most folks recover quite well.
That's good to hear. And just in closing, if a person suspects they're, clinically depressed, it's like, are there any, self-diagnoses? What should people do what should people be looking for? What should they do if they think they fall into this category?
It's one of those things that stigma is there in mental health. So I'd say, if anything, reminding yourself that quite a number of individuals, older adults included, do struggle with depression. And because it is it's out there, it is being discussed, there is help for it. So encouraging folks to speak to your doctor or even loved ones just to say, you know, I think this might be happening. What do you think? Just getting some feedback from your medical professionals as well as people in your life. I think just talking about it and putting it out there can be quite useful for individuals, especially if you start looking into what treatments might be useful and becoming more open to or just building on your knowledge of what is possible out there, because sometimes there's just a sense that there is no help or other people haven't experienced this before, other people wouldn't understand. And generally when people do seek help for depression or get connected in some way in their psychiatric care, there is that sense of relief that people experience once they actually get the treatment and help they need.
Well, great. Well, thank you very much for helping to fight the stigma, Dr. Altman. If you want to see some of Dr. Altman's writings in the world of mental health and seniors, please come to SeniorLiving.org. And for more informative videos of Dr. Altman, subscribe to our YouTube channel. Thank you very much, Doctor.
Thank you.